Doctors use a simple rule to recognize droop. It is called FAST. F for facial drooping, A for arm weakness, S for slurring of speech, T for time to act fast. In Bell's palsy, usually the face is only affected. The arms and legs are normal, speech is clear. But if you ever feel unsure, treat it as an emergency. Bell's palsy affects the seventh cranial nerve, also called the facial nerve. Think of these nerves like a soft garden hose running through a very hard, narrow tunnel inside the skull. This nerve does much more than control your smile. It controls blinking, tears, saliva, and even a tiny muscles in the ear that reduce loud sound. When the nerve becomes swollen, it gets squeezed inside the tight tunnel. That's why some people suddenly feel normal sounds are painfully loud. This is called hyperacusis. Recovery from Bell's palsy does not happen overnight. It happens in stages. Stage 1 is the onset phase, lasts from day 1 to 3. Symptoms often get worse before they get better. This is normal. Stage 2 is the plateau phase, lasts from week 1 to week 2. No movement, a lot of frustration. This is the hardest mental phase. Stage 3 is the twitch phase, lasts from week 3 to 4. Tiny flickers, small eyelid movement, a corner of the mouth lifting. This is a very good sign. Stage 4 is the reconnection phase, lasts from month 1 to 3. Muscles slowly become stronger as the nerve heals. And finally, stage 5, the long tail phase. About 20% do not recover completely. Some develop a condition called synkinesis, where nerve crosswires and muscles move together. Now, this part is extremely important. If facial paralysis comes with severe ear pain, blisters or rash around or inside the ear, along with hearing loss or dizziness, this may not be Bell's palsy. This could be Ramsay Hunt syndrome caused by herpes zoster virus. And this needs urgent treatment. Bell's palsy is usually painless. So if you experience pain and rash, do not wait, see a doctor immediately. Treatment works best in the first 72 hours. This is called the golden window. Doctors often prescribe steroid like prednisone. Steroids reduce swelling of the facial nerve inside the tight bony tunnel. Some doctors also prescribe antivirals such as acyclovir. This is because many researchers believe a dormant virus, commonly herpes, triggers the inflammation. Mild cases may recover on their own, but early steroid treatment significantly improve recovery in moderate to severe cases. Home care is just as much important as the medication. First, do eye protection. Use thick lubricating gel at night, tape or gently patch the eye closed while sleeping. Second, do massages. Gently massage the affected side using slow upward movement. This keeps blood flowing and muscle flexible. Third, the mirror technique. Do not force a smile. First, imagine the movement and then gently guide your face with your fingers while looking in the mirror. You are reminding the brain of the correct pathway. Fourth, heat therapy. Warm compress on your jaw. Bell's palsy often appears when the immune system is exhausted. Stress, illness, lack of sleep, having diabetes are known risk factors. Vitamin B12, especially methylcobalamin, supports nerve healing. And on emotional level, losing your smile can be painful. It affects confidence, it affects a connection. But remember, most people recover fully. Your nerve knows how to heal. Your smile will return. Be patient with your body. It is working for you. If this video helped you, please subscribe and share it with someone who is suffering from facial palsy because sometimes information is the best medicine.